Hey, it's Jessica DaMassa with WTF Health. I'm here at the Together.Health event at HIMSS 19, and joining me right now, I have one of HIMSS's very own. We have Leslie Evans. She's the director of the HIMSS Innovation Center in beautiful Cleveland.
Exactly. It's nice to be here in Orlando in the winter, I'll tell you that.
I bet. All right, Leslie, so it's great to have you here and contributing to the conversation on behalf of HIMSS as far as what Together.Health is. So for those who are listening, watching, this was the Digital Health Collaborative that is now relaunched into Together.Health, and they've their mandate is still the same, to bring together all the ecosystem players to try to help push innovation faster into the healthcare system. Talk to me, I guess, about how HIMSS is going to support this initiative. Obviously, as one of the big organizations in the industry that's like supporting all of us professionals, what is it that HIMSS wants to bring to the table and do with Together.Health?
Well, I think it's wonderful because our missions are so aligned. It's all about collaboration and bringing people together, which is what we do well at HIMSS. So how we're supporting it, we are participating on the steering committee. There are a couple of representatives from HIMSS that are engaged in the steering committee meetings. And as you said, Together.Health is very collaborative. So we meet monthly, we check in. We've attended their sessions in Boston. Here we are providing space for them to use and really access to market this meeting to our members as well. So just to get the message out.
No, that's awesome. And I know HIMSS supports a lot of different innovation initiatives, and this is a great one for us to have your support on this as well. So tell me, I guess, I want to pick your brain about innovation within HIMSS, because as somebody who's watching the industry, who's sitting in the Innovation Center, and who's curating, what kinds of events happen there, what kind of conversations are happening within your walls, what kinds of exhibitions you guys are showing. So what's going on? Give me a little bit of a state of play of health innovation, particularly on the health IT side.
Yeah, well, I'm going to tell you, so my spin is a little different, and you're going to hear about it. Ours is really about the person at the center of it.
Okay.
And so even the collaborations that we're doing here with Together.Health, at the last steering committee meeting, I was engaged with Omkar Kulkarni, who's with the California
Children's Hospital of LA.
Thank you.
Thank
you. We've been speaking a lot. And I shared about some of the work that we're doing at the Innovation Center. So we're really looking at opening up access for startups, for creators of technology, and giving them an opportunity to really connect back with the community, with the patients. So an example of that, so it's kind of technology agnostic, if you will.
Okay.
It's really about listening to the community and thinking, what problems are we trying to solve for?
Okay, so you're doing more of a helping in terms of ferreting out what the problem is and defining that problem space so that startups that do know the tech and can throw all sorts of digital solutions at something have a better idea of what it is they're solving.
That's exactly it.
Okay, and we keep hearing, and I would love to know if you agree with this, that's one of the challenges in health innovation is that oftentimes startups will come with the technology, but they don't have a problem that they're solving.
Exactly, yeah. And I think that the biggest thing that we're seeing and what we're doing even through Together.Health is thinking, who are the patients that we're trying to solve for? So in a couple of circumstances with the HIMSS Innovation Center, the first one we worked around was infant mortality and how it disproportionately impacts the Black community. So in Cleveland, where we're located, we are surrounded by world-class healthcare systems with research universities, and yet Black babies die at a rate 6 times greater than white babies. That's in Cleveland. Yeah. So it's unacceptable. So what can we do with this prowess of healthcare in our backyard? And what we did is we really brought the community in. We brought those mothers into the Innovation Center. We brought families who wanted to become parents but were prohibited from that due to systemic race or stress. And we listened to them, but we had the right people in the room because of HIMSS outlets. So we had community health workers, we had clinicians at the table, we had health IT vendors, we did have startups as well. And we really directed them to stop and listen. And then we took a chance at defining the problem after we heard that. And then through HIMSS marketing, messaging, and network and our platform, we really launched a global developer challenge to invite technology to solve for this problem. So we're doing a lot about that. And right now with Omkar, we're focused on the Latinx youth and young adults. So likewise, we're bringing the Latinx community in and we're listening to them as well. So you can't have people, you can't solve a problem for clinicians if you're not listening to the clinicians. You can't solve a problem for Black mothers if you're not listening to them and learning and really engaging them in the design process. So that's, I think, where we're really, our sweet spot is connecting them.
That's fantastic. And I would like, obviously as HIMSS, I mean, you're an industry leader. I mean, you're an organization that everybody looks to, particularly on the information management side, on the IT side.
Right.
So, I mean, what you're talking about is in terms of the vision for the Innovation Center is, bringing the patient in and understanding their pain points.
Right.
I'm sure you also, though, are addressing some of the, I don't know, like the healthcare nerdy
absolutely.
data
Yeah.
geekiness of us all. So
Yeah.
talk to me a little bit about what you're offering there.
Yeah, I mean, it all comes back to data as well. So we're really looking at how we're using data to solve these problems. So to your point, we talk a lot about artificial intelligence and how we are, again, listening, which artificial intelligence does, right? So listening, solving, getting to refining the problem earlier. We focus a lot on cybersecurity, revenue cycle management. I mean, all of the hot topics within HIMSS. We do host executive briefings. We bring the right people together. So at any given day, we may have 25 of the leading, health executives from across the globe in our space, or we may have 200 startups pitching at the Medical Capital Innovation Competition, which this year we're really focused on AR and VR in healthcare specifically. We started it broadly. Just if you're a startup focused on healthcare, come to us. And now we're really refining that and saying, as we're looking at different topics, how can we do that? So this year we're focusing on AR and VR. And again, as we're looking at connecting the community, another big one for us, and what I'd like to play in at the Innovation Center, is really around voice-activated devices. And the next community I would love to engage are veterans, and then some of our aging population as well, to bring them in, and again, to have them experience some of these solutions that are out there.
Awesome. Well, Leslie, it sounds like you've got a lot on your agenda, so we'll leave you at it. Thank you so much for joining us. It's always a pleasure to hear what you guys are working on over there at the HIMSS Innovation Center. Thank you. I'm Jessica DaMassa with WTF Health here at HIMSS 19, the Together.Health event. Thanks so much for joining us.